because we have another exciting and engaging day, maybe you could just turn to your neighbor and ask them this simple question. Since we're from across the globe, we want to just hear a bit. What is your favorite thing about your country? You can ask your neighbor, what is your one favorite thing about your country? I know some of us have a lot of complaints, but it would be good to have some positive vibes. All right. I see there has been some engagement. All right. I see there's been some great engagement already. So now that you were able to ask what your neighbor's favorite thing was, maybe just to get a few rounds from the floor.
I heard rolling hills and I heard sense of humor of Egyptians. I come from Egypt, so.
All right, so from here we've had rolling hills, sense of humor. Let me see who else to ask. There's some engagement here. All right. Maybe you could share.
Good morning. So he loves the good weather and she loves the good flowers all over Kenya.
All right, great. So we've had flowers, weather, rolling hills. I mean, fantastic things. You see, if we scratch the surface, there's so much good we can find about our countries. I know sometimes we have more complaints than positive, but indeed, we belong to countries. So with that, we can kickstart the day. And today we're going to do things a bit differently. And we're starting with a bang. So we have a lady, none like her, I must say, wears many hats. She's a poet, a playwright, a performing artist, has traveled the world, including, this is just a tease of where she's performed, Hey Festival UK, in Greece, across the globe. And funny enough, she has also another side to her. She's one of us colleagues. She used to work for the United Nations and the World Bank. So we usually say we're always with our papers, but we can be poets too, right? Yeah, I mean. So today, if we could all put our hands together for none other than the renowned, the wonderful Sitawa Namwalie.
Thank you very much, Vicky. And thank you very much for this invitation. Elaine, whom I've just met today, invited me after I met her husband in Greece. I'm really pleased to be here with you. I remember this particular type of engagement. I had fun, and sometimes I was bored. And I wish there was somebody like me, a poet, to spice things up. So I'm going to do that for you. So this poem is called A Woman's Body Parts. A woman must have the ability to reattach her body parts every time they fall off. This useful advice was given me by my grandmother, as we sat together peeling bananas for a meal. A woman must have the ability to reattach her body parts every time they fall off. Over the years, my aunties added their voices of counsel to hers. Yes, they said, don't hold on too tightly onto your body parts. You will only cause yourself harm. I confirmed their words as I watched my mother reattach her body parts every time they fell off. My grandmother was unequivocal. A woman does not have the luxury of permanent body parts. They must remain detachable. By the time she's grown, her body parts will fall off quite regularly. Nothing to alarm. She must gather up the bits and pieces, put them back together again. When she falls into disarray, only she knows her design. A woman must have the ability to reattach her body parts every time they fall off. Now, her body parts may fall off when she feels threatened, when a man stands and scowls down at her, when her opinion is disregarded. A woman need not be alarmed. She must learn to simply pick up the fallen part and reattach it. My grandmother was clear with her instructions. To reattach a fallen body part, a woman must start with the arms. With her hands firmly in place, she can reattach the other parts. Now, a woman's nose may fall off quite often. It is a rather sensitive part of the body and has a tendency to take fright and jump off the face and go into hiding. When reattaching the ears, a woman must start with her left ear, then her right ear. This will allow her to hear again. When attaching the lips, a woman must take care not to reattach them upside down. She does not want to look like a bird with a beak. Now, she can pop her eyes back into their empty sockets. They may make a sucking sound when pushed back into her head, but this is a small price to recover her vision. Okay, now she can place her head back onto her neck, being careful not to lay it askance, or worse, back to front. Finally, the legs. Attach the right leg, then the left leg. My grandmother added this bit of wisdom in the dark as we lay waiting for sleep. You see, she said, with her legs firmly in place, a woman can go anywhere. But what should a woman do with her welling tears, I asked. Grandmother was clear on this too. Let the tears flow. Let them go. Let your wounded core escape. It is the only way a woman can keep from damning her soul. Thank you.
Another round of applause. So before we ask Sit Howard to take her seat, we'd all like you to be poets just for 2 seconds. So she's going to say a line, we repeat, and another line, we repeat, and then we also bow in our seats and then move to the next session. All right, over to you, Sit Howard.
Okay, so you heard that particular poem. And you heard the delivery. Did you not hear the delivery? Yes? So performing a poem is not just about speaking randomly. You must learn how to deliver as well, okay? So you must enjoy yourself as well. So we're just going to go back to that particular poem. and just say, repeating after me, a woman must have the ability to reattach her body parts. Every time they fall off. This useful advice was given to me by my grandmother. As we sat together peeling bananas for dinner. A woman must have the ability to reattach her body parts every time they fall off. Thank you very much. You did very well. Clap for yourselves.
Thank you so much, Sitawa. That was exceptional. Indeed, a woman's body parts. Powerful, powerful, powerful. Now with that was just the perfect segue to our next session, because what is about to be brought to the stage is beyond your imagination. The world's first adolescent sexual reproductive health development impact bond in Kenya. I know that was a mouthful, but impactful indeed. So for that session, we have none other than, I know he did a fantastic job yesterday. I mean, we had to call him again to come back because it was just exceptional. We just had to follow him and get his business card. His name is none other than Arif Neky, Senior Advisor, Strategic Partnerships, United Nations Resident Coordinator Office. I'm the coordinator of SDG Partnerships Platform. This is where you should send your CV after that. All right. Welcome, Arif. Over to you for the next session.
Thank you, Vicky. Isn't she fantastic? I mean, really give her a. This is a great blend of charm, poise, the energy of youth, eloquence. Well done, Vicky. Fantastic. So, colleagues, very exciting first session for today. I hope you all enjoyed the discussions yesterday. I know I learned a lot. I mean, Elaine had all these IFIs, DFIs in a line. I was just amazed how that discussion went. The ESG, rather more complex discussion that Max navigated, what Munir did at the first one on blended finance, really exciting. Today we're doing deep dives. We're looking at some very interesting milestones, interesting deep dives around some of the SDG fund investments that have come through in the last round. I'm very excited because Kenya was one of the awardees of the SDG fund. We had, to cut a long story short, we had a call for proposals. I think it's global, over 190 countries, 155 applications. We got a nice polite email from Max and Elaine saying, guys, you were 16th. Sorry, you didn't win it, but you didn't lose it. So here's $100,000, go strengthen your proposal and knock on our door again. We spent a year, we did that. We have a great consortium that you'll hear about. And touch wood, we started the year off with a bang with the announcement that we were awarded $7 million into our world's first, we like to think, Adolescent Sexual Reproductive Health Development Impact Bond, which is a consortium of UN agencies and private sector partners, which has been really a pleasure to work with. So without further ado, we'd like to start our session. I'd like to invite the UN Resident Coordinator ad interim, who is also our UNDP resident representative, Walid Badawi, to make a few remarks and get us off the ground, and then we'll follow the rest of the program. Thank you so much. Walid, welcome. Also, as he comes up, a special mention and welcome to Dr. Estella Waiguru, who is from the ASRH program in the Ministry of Health. Colleagues, please put your hands together for the Ministry of Health.
Thank you, you so much, Arif and Vicky, for a wonderful start to the day, and good morning, one and all. Again, my name is Walid Badawi. I am standing in for Mr. Stephen Jackson, Dr. Stephen Jackson, our resident coordinator for Kenya, who, as you know, is not here. But I acknowledge Dr. Estella Waiguru from the Ministry of Health, representing Mr. Arashidaman, who is unable to join us today. All of the resident coordinators here present, all of the UN colleagues, representatives from everywhere in the continent, the private sector, I welcome you all protocols observed. Let me first start by wishing you all a happy Africa Day. Today is Happy Africa Day. And a big round of applause for our beloved continent. But it also, as I was in another meeting, it is my birthday today. So you can all say happy birthday, Walid, as well. So it's quite an auspicious occasion for me personally, but for all of us living and having the privilege to live in this amazing continent. But let me perhaps start, and this was a great practice session for all of us to practice poetry. And I hope you've mastered the technique. So a woman must have the ability to reattach her body parts every time they fall off. How is that for delivery? Is okay? A little bit okay. And I would add to that a man must have the ability to reiterate his words every time they don't come out right the first time. Thanks, Elaine. But on a more relevant note to our conversation this morning, mine is really to kick us off and set the stage on behalf of Stephen, and to say what an amazing privilege it is for all of us to continue to be in this room. As I came yesterday, delivered some opening remarks, and I come again today, and to see the room filled with so many passionate people that are driving towards changing the financing landscape for the SDGs on this continent. It's truly, truly inspiring. And I take it that you are certainly champions of the agenda and not gluttons for punishment, but certainly champions of a cause that I think we truly, truly believe in. But today, I think a lot has been said already. Arif did a very good job to tell us that we're going deeper into some of the aspects of these innovative financing models. And it's amazing to be, it's a privilege for all of us on this Africa Day to actually be launching the world's first development impact bond on adolescent sexual and reproductive health. SDG target 3.7, as we are well aware, is exactly where the financing that we hope to raise through this innovative bond will create traction for here in Kenya. So let us pledge our support to ensure that wherever we may sit, be it in the UN, be it in the private sector, be it in government, that we do put our hands together to ensure that the capitalization of this bond, but also its implementation through effective initiatives on the ground does materialize. So thank you all for being here, and mine is to invite my dear sister, Medine Sehayu, the UNAIDS country director in Kenya, who's also chair of the H6 group in our country team, to come and guide us through the next segment. Medine.
Thank you so much, Walid. Good morning once again. My name is Medine Sehayu. I know the last name is difficult, so I always advise you to use the first name, Medhin, which is easier. And a very privileged to moderate this session, which is very practical, because yesterday we have heard from colleagues on the different instruments, tools, the social impact that we have heard from Ghana and Rwanda. And now today we'll have the opportunity to better understand and diving deeper to know what development impact bond is. And as Walid introduced, this is the first development impact bond on adolescent sexual reproductive health. And this was selected from 100 countries' submissions. 155 actually. So it was found one of the most, feasible, again, bankable project as it was presented yesterday. And we are very, very pleased to have the opportunity to indeed experience, what it means and how we are going to implement it. Just to give a few numbers, because, in the UN, not only in the UN, even yesterday we talked about metrics, right? It's very important to understand why deep on adolescent sexual reproductive health. So if we look at the Kenya demography, over 35 million people of the total population are under the age of 35. So it's really a youthful country, and it's the same trend in the whole of Africa. So it's very important to invest on young people. That's one fact. Then the other fact, when we look at the HIV prevalence, in Kenya, we have about 1.4 million estimated people living with HIV. And looking at the new infection rates, almost 41% of the total new infections come from adolescent and young people. I hope Dr. Estella agree with me on this. And then when I further break down by male, female, 70% of this new infection account among adolescent girls and young women. So can we ignore this area? Impossible. So I think that's why now, this project or this deep becomes very, very important for all of us. And as it was introduced, it's a joint program within the UN, UNFPA, of course, RCO, Dr. Stephen Jackson, our brother Arif, WHO and UNAIDS. So, the joint program is in there. But now in the model itself, I think it will be quite interesting, and we'll hear soon from our panelists. So it's now my privilege to invite the panelists, first of all, to the podium. Number one, I will ask Dr. Estella to join us. Mr. Amit Shah, who is the Director of Investment in Bridge Outcome Partnership. Then Mr. Richard Matikani, Director of Triggerise, actually the Chief Operating Officer, the right title. And then Ms. Julia, the Director in CIFF. Then I have Mr. Akacho Ekirapa, the Health Advisor in the FCDO. And then we have a young person, Representative Christabel Arunda. Please, join me here.
Medin, just a slight correction. So Ministry of Health will be coming in a bit later. Okay. And we have a video before we kick off the panel.
I wanted to invite them. So we'll have now a short video to see why we need to invest in young people, because that is basically the theme of this summit as well. So I invite now the video to be played. Is it coming?
and let's go for a ride.
For sure, you see, numbers never lie.
Never.
Today's adolescents and youth are 1.8 billion strong and 1/4 of the world's population. In Kenya, 75% of the population is below the age of 35 years, with adolescents 10 to 19 years representing 24.5% of the population and numbering approximately 11.6 million, while the youth between the ages of 18 to 34 years represent 29% of the population and are estimated at 13.7 million.
Imagine that. And Biko and I are part of that huge family. Indeed, this large youthful population can spur the country's development agenda if the right investment are made in the health, education, empowerment, and employment of the youth.
Kenya can indeed reap the demographic dividend. Do you know what that is? It is accelerated economic growth achieved by having a large proportion of people of working age compared to dependents.
That's very true, Biko. At the moment, unemployment amongst the youth has become a thorn in the flesh in many developing countries like ours, Kenya. Unfortunately, about 16.3% of youth between 18 to 34 years who are economically active are unemployed.
And what about education? Great strides have been made to ensure high school enrollment, transition, and completion rates from pre-primary to secondary school level.
Nonetheless, gaps still exist in transition and completion rates between primary and secondary school level.
Teenage pregnancies and harmful cultural practices such as female genital mutilation and child marriages are some of the barriers to school transition and completion, particularly among girls.
Imagine at that age of 15, somewhere in Kenya, a boy is studying, and as a girl, you are already married off. Yet at that age, Louis Braille was busy inventing Braille.
Braille, that's amazing. I feel like some of the communities need that vision too, to help them see how they need to invest in the youth and their education.
At that age, a young person's life can be changed at the snap of a finger.
Like Thanos?
Like Thanos? Ha ha ha. But seriously, lack of proper education, poverty, gender-based violence, harmful cultural practices, and limited access to sexual and reproductive health information are some of the reasons we have some grim statistics of young people between the ages of 15 and 24 years. This age accounts for more than 1/3 of all new HIV infections.
Worse still, only 54% of girls and 58% of boys possess accurate knowledge of HIV. In some instances, laws and policies exclude young people from accessing sexual and reproductive healthcare and HIV-related services such as voluntary and confidential HIV counseling and testing, contraception especially among sexual active young people, and sexual and reproductive health education.
All this has led to even more grim statistics, with 1 in every 5 teenage girls between the age of 15 to 19 years being either pregnant or has already given birth. 11% of girls between the ages of 15 to 19 years having experienced FGM. 7% of girls and 3% of boys between the ages of 15 to 19 years having ever experienced sexual violence, and a sizable proportion of girls being married before the age of 18.
There is hope though. In this digital era where 70% of youth are online, information is everywhere.
Moreover, parents and caregivers must now equally play an active role in the lives of young people by being available and offering relevant guidance on difficult topics such as sexuality.
That's very true. The case for investing in young people now is more than clear.
The solution is truly simple. Invest in the youth. Investments in the health, education, employment, and overall well-being of young people is crucial in helping them reach their full potential. Empowering the youth greatly enhances Kenya's productivity and prospects for development.
When given the right opportunities, youth are effective drivers of change and can create a resilient, sustainable future. And that is the future we want.
Thank you so much for that video, and we have gotten more statistics on what is affecting young people in Kenya, and giving us a good background now to the next segment. And I will invite Richard, the Chief Operating Officer in Triggerise, to give us an overview on the first Adolescent Sexual and Reproductive Health Development Impact Bond. Richard, you have the floor.
Great. Thank you very much, Nadine. Could you slot in the presentation? So I just wanted to introduce myself. My name is Richard Matikanya. I work with Triggerise, and Triggerise is a Dutch nonprofit that uses technology, essentially digital motivation platforms to connect young people to sexual and reproductive health services. And more recently, we've already started also connecting young people to mental health services, to job skills and employment services as well. So I'll quickly give an overview of what we do, how we work, and then take you through the bond. The bond is quite interesting because it actually had two phases. The first phase is the part that we've been implementing immediately by ourselves as the core implementer. And then the second phase, Anders will talk a bit more about in terms of the financing now that we've received from the UN SDG fund in terms of what we want to do and how we'll take that forward. Next slide. Next slide. So basically, as I said before, we are a Dutch nonprofit. We use technology, and we saw the little video here about young people, 75% of them being online. And what we do is we take advantage of that technology to enable young people to then connect for services that respond to their needs. And essentially, we use what are known as digital motivation platforms, and they essentially work like Uber. How many of us have used an Uber before? I can see quite a number of hands. So essentially, what our technology does is it connects similarly a rider, yourself, and in our particular case, it'll be adolescents and youth, to a service. In this particular case, if you're on Uber, it would be a driver. Ours then connects young people to quality assured service providers who are then able to provide them with access to sexual and reproductive health services, jobs and skills, and mental health. And what we've managed to do over the course of the year, we're actually a young organization. We're established in 2014. So we're just over 7 years now. And over that period, next slide, please, we've reached 1.8 million adolescents and young girls. We work with a range of partners to be able to deliver services. And those partners include standard franchises that deliver SRH services, public sector facilities, pharmacies, training providers, and then who then connect with young people. So I just wanted to then quickly take you through now in terms of the impact bond. And just a quick question around the team here. How many people know what impact bonds are? 1, 2, 3, 4. Great. So not a lot of you. So maybe what I should start. So basically, an impact bond is a financing instrument that is used depending on who's actually using it. So if it's a government that's using an impact bond, it's called a social impact bond. If it's a donor or philanthropist, it's called a development impact bond. And what we've been implementing in Kenya is a development impact bond for adolescent and sexual reproductive health. And essentially what happens with impact bonds, there are 4 players usually. So the first player is what we call an investor. So who can tell me quickly what an investor is? Someone that gives you money for return? Yes, there's someone that gives us money for return. Just a quick, are there any investors on the table? Are there any investors here? Because we're certainly wanting to be having a chat with you. Yeah, so an investor is someone that gives us money to support a particular activity or action in return for not only their own capital back, but also in return on that investment. So that's an investor. The other key player is called an outcome payer. Does someone know what an outcome payer is? Okay, so essentially an outcome payer is someone who pays, there's someone who invests in terms of saying, I promise I'll be able to deliver particular outcomes. And the outcome payer is the one who says, guess what? If you do deliver those outcomes, I'll give you the cash. So they're the ones who give you the cash as well as the return on your investment. Thank you very much. Then there's an implementer. And essentially in this particular bond, that's what we are. We are the ones who the investor says, guess what? I think we have a bit of confidence in you, or a lot of confidence in you actually, because we are putting our money up front that you'll be able to deliver us the outcomes. So that's what we are. We are now an implementer. So there's also an implementer. And then finally, because there's always issues to do with trust, there's always a third party who then does verification, right? So there's a third party who then does verifications. And in other impact bonds, and I know Amit will talk a bit more about that later on, you even get a performance manager. Sometimes investors don't also trust the implementers, and they also then contract a performance manager just to keep an eye on you to ensure that you're delivering on your bond and that you're going to deliver so that they get themselves paid. So essentially in Kenya, we have been, we started off with phase 1 of this impact bond. Next slide. Next slide. And essentially, you've all seen the statistics. We decided that we wanted to focus on adolescent sexual and reproductive health. And the goal of it really has been around reducing the incidence of unwanted pregnancies among adolescents aged 15 to 19 in Kenya. And we were focusing particularly in 16 out of 47 provinces, districts, counties, sorry, and there's reasons why we selected those counties. The first one was really high teenage pregnancy rates. The second one, already as Medina has talked about very early on, high HIV prevalence rates. And then associated to that is unsafe abortions. If a lot of these pregnancies are unwanted, we saw high rates of unsafe abortions. And then finally, also, what we saw is very high maternal mortality rates, particularly among adolescents aged 15 to 19. So the aim of this bond really was to increase access and uptake to contraception and reproductive and sexual health commodities for adolescents in this particular age group. And in terms of the investor was Children's Investment Fund Foundation, and our colleague Julia is here, and she'll speak a bit more about her role and CIFF's role as an investor. In terms of outcome payers, the outcome payer was actually the British government, FCDO, the Foreign and Commonwealth Development Organization. And then finally, in terms of implementation, we were implementing the program, and then HERA was the third party. They were responsible for verifying that we achieved the matrix. Do you want to go into the next slide? So just in terms of just the investment terms and conditions. So essentially, in terms of the investment amount, it was $6.4 million. The duration was 18 months. And there was 3 key payment matrix. So the first payment metrics on the capital. That is the initial investment amount that's actually made by CIFF related to us reaching particular SRH targets relating to visits, and then also ensuring that young people returned on those visits. And then the second matrix, which will be the IRR matrix, which is the profit essentially that CIFF will make, is dependent on us achieving a matrix related to modern contraceptive prevalence rate. And we were implementing it in 16 counties. And there are 2 payment schedules. I don't know if you can see the deck. It looks a bit small from here. But essentially, there was a payment at 19 months for the initial capital because we're implementing over 18 months. And then the investment return will take place at 22 months. And essentially, it's because the third-party verifier is actually now undertaking a survey to assess whether or not we've met the target related to modern contraceptive prevalence rates. Next slide. So just to give you a quick summary of the results to date. So essentially, as I mentioned earlier, there were 2 key matrix. So the first matrix related to the principal payment. This is the $6.4 million. And that we closed the implementation in February, and essentially we've met and exceeded those metrics quite significantly. So I'm quite happy that Julia is going to be getting her initial investment back. And then we were also asked to take a look at cost effectiveness in terms of our ability to be able to deliver. This was a learning outcome in terms of can we deliver adolescent SRH investments and interventions for adolescents more cost effectively, efficiently, ensuring that we also take equity into account. And essentially, also there, we've done quite well in terms of really delivering this program efficiently. So not just in terms of exceeding the targets and metrics that have been set, and they're quite ambitious, and we're actually implementing under COVID, as you all know. And then the final one on the profit matrix in terms of the IRR, that is still a work in progress, and we are hoping to hear from the third-party verifier very shortly. But that's just a very quick summary of the investment bond itself, the terms and conditions, and our colleague Anders, as he begins to talk about this new phase that we're going in together with the joint UN SDG fund, we'll get into a lot more detail in terms of what it is we want to achieve there and get done. But otherwise, this was just a very quick introduction to get you to understanding a bond.
Thank you so much, Richard, for the introduction and the overview of the development impact bond that will now take us to the next panel to understand better. Yeah, although he has already introduced what it meant, who are the players, but still we have great panelists here who will now, give us their perspective as well. So, do we have the mic? Thank you very much. So before I start asking the question, let me once again introduce panelists. So Amit, great to have you here. And maybe I will give just briefly a chance to also say something more than what I have already said as part of the introduction. Thank you.
Thanks, Madine. So thank you to the Joint SDG Fund and the Partnership Platform for inviting us to be here today. It's really exciting. And the launch of this program is a milestone in the development impact bond world. So it's a fantastic project. So my name's Amit. I work for an organisation called Bridges Outcomes Partnerships. We have been a pioneer in the space of social impact bonds and development impact bonds. Been working in the space for the last 10 or so years, and we've invested in over 60 of these contracts. Our work was primarily focused in the UK, but we have recently moved our work to be international and focusing more on development impact bonds. And we are in the process of launching a fund to do just that. So thank you, Madine.
Thank you very much. Richard, do you have anything more?
No, none now. Just pass on to Julia.
Hi, everyone. Good morning.
Morning.
Come on.
Yes.
Good morning.
Morning.
Thank you. Very good. My name is Julia Greenland. I'm a director in the Grill Capital team at the Children's Investment Fund Foundation. The Children's Investment Fund Foundation is a private philanthropy with its roots in the UK, but we have a significant Africa office, and I work in the Nairobi office, and we were the investors in the pilot version of this impact bond.
Thank you. Akachu?
Thank you. Good morning once again.
Good morning.
Looks like people need to have some tea. Good morning.
Good morning.
My name is Akatwe Kirapa. I'm the health advisor at Foreign Commonwealth Development Office, and I'm also a technical lead for the DESIP Family Planning Program. So probably maybe don't know that UKAID funds the largest family planning program in Kenya. So as part of this development impact bond, we are the outcome pair, and we shall discuss more about the pilot now that the one that the UN is picking up. Thank you.
Thank you. And then our young person.
Good morning, guys.
Good morning.
I'm Christabel from Kibra, Aoche Foundation. I have nothing to say about this. I'll talk about TICO.
Okay. Yeah. Thank you so much. Yeah, thank you. Thank you so much. So now it's about development impact bond, right? As one of the financing mechanism. And we want to hear more now from Amit. What is really a development impact bond? And why is it a potential instrument for financing SDGs, right? And what are the pros and cons having this arrangement or instrument using, as opposed to the traditional funding mechanism? So maybe you can give us, more insight. Thank you.
My colleague Richard unfortunately stole half my thunder during his presentation. But maybe let's set some context. So we're all in this room today because we want to focus on achieving the SDG goals. That's why we're here. That's our objectives. We heard some incredible discussions yesterday about how to crowd in more private capital to achieve those goals. So we heard, from the DFIs, we heard from, Dr. James Mwangi in the morning, and we heard from a host of private equity entities, etc. So it was a fantastic discussion and an incredibly important part of filling that funding gap that's going to reach $4 trillion. However, if we are going to achieve the SDG goals, when we look at the goals as a whole, not everything will be able to be funded through private capital. Not everything will have a commercial return attached to it. We look at the goals and we will need things to be funded by the donors, by governments, etc. if we are going to get to where we all want to get to by 2030. So it's still a fundamental and important part of how we are going to achieve these goals. So in that context, and in a world where we are moving away from aid to trade, when we are seeing funding flows potentially reducing over time, what I think a development impact bond helps with is ensuring that those funding flows that do remain are doing the right things, are focusing on the right goals, are achieving the outcomes that we are hoping to achieve with that funding. So what a development impact bond does is it sets goals or outcome targets for that are to be achieved with the funding that the donor or outcome funder, be it government, World Bank, whoever it might be, what wants to achieve. So rather than saying, with this funding, you are delivering this specific service, it is saying, with this money, we expect you to achieve this goal. So in the context of a program like this, it's about improving the awareness of sexual health challenges and improving well-being and for girls. In other programs, we are looking at the moment at a couple of programs in Western Africa where rather than, for example, funding schooling, the donors and the government will be funding learning gains. So actually, can we improve the quality of learning that happens in schools, and can we improve the well-being of students in those schools? So the idea is to move away from funding a specific service towards funding what the goals of that service are. Why that's important and why we believe it's a powerful way to work is it allows for the service provider, the implementer, so in the case of this program, Triggerise, to be able to think through, as they are delivering, they'll see different challenges come up on the ground. They'll, as you're working with individuals, as you're supporting them, you'll see different issues come up that you may not have realized when you were starting the program. So what this method of financing allows you to do is innovate. It allows you to change your delivery as you're moving through. It allows you to reset. It allows you to, if you are seeing hurdles, be able to overcome those hurdles, because you aren't delivering a specific service, you are delivering the outcomes. It allows you to change your delivery to ensure that you are delivering those outcomes. So that is the biggest value of delivering in this way. I'd like to refer a little bit to the words of Dr. James Mwangi yesterday. I mean, he said a lot of interesting things, but I'm going to refer to my notes because he said some things which he was talking about how to crowd in more private capital, but they all applied here. So the big benefits of this way of working, the first is moving away from process and moving towards outcomes. So what this process allows is for every organization that's involved, and as Richard mentioned, there's a bunch of parties that are involved to make a transaction like this work. It aligns their behaviors. It makes sure that they are all focused on delivery for the individuals that we are working with when it's set up well. So that's a very important thing. He also talks about partnerships and often when we are working across private and public sector, you add in the donors and the foundations into the mix. Actually, we all talk different languages. We all have different ways of thinking about the world. What this mechanism does is it allows us to align around a common language of what we're all trying to achieve. So this is a really powerful thing, and when it works well, it really helps kind of bring together different actors who haven't worked together before, achieve what they're hoping to achieve. So those are the biggest pros. I mean, in terms of the cons, I think one of the challenges that we see with these programs is they do take because people are talking different languages and you are bringing together actors from different parts of the system, you are bringing together, kind of capital providers like ourselves, you are bringing together delivery organizations like Triggerise, you are bringing together funders like FCDO or the UN Joint Fund. Building those partnerships, getting the alignment of those organizations can take time and energy, and as you all know, that some of these projects do take a fair bit of time to deliver. However, I think that time is really worthwhile when they are done well.
Thank you so much, Amit, for those pros and cons, but also what it does and how it is different from, the traditional instruments that we have just, delivering services, but mainly focusing on the outcomes. Thank you so much. Richard, I know you have already, started to elaborate, what it does, what has been your experience, but maybe you have additional points to make on why you did choose, the development impact bond as the financing instrument, and what were your experience as an implementing partner, especially from the pros and cons side that Amit alluded to.
Sure. I think Amit has also taken my thunder this time in terms of talking about why we were particularly interested in, revenge, he said, why we were particularly interested ourselves as Triggerise in the bond. And I think, again, just to quickly reiterate, for us, it's around alignment and a key focus on outcomes. We've been very much focused on output and processes, and this impact bond gave us an opportunity to really focus on how can we achieve outcomes, what is it that we need to do in terms of achieving outcomes, and then also for us, really about proving the utility of our own model in terms of helping us to be able to achieve outcomes. So for us, that was very attractive in terms of us wanting to get on and implement this particular bond. The second reason for us was the ability that it would give us to be able to adapt. So with traditional grants, with a donor, there's certain amounts of money, they're quite restricted. When you start talking about changing what you want to do, there's always challenges with that. And what an impact bond allowed us to do was adaptive implementation, that would have the opportunity to continuously adapt and iterate our programming. And then finally, for us, the reason why we were very excited about the impact bond and delivering through the impact bond was really about an opportunity for us to really show that SRH is an investable case for delivering on the SDG and for delivering outcomes for young girls and adolescent girls and young women with regard to SRH. So because that's a core purpose of who we are and what we do, and we wanted to explore and identify mechanisms that we can use in future to be able to then raise additional resources. And for us, this has really been instrumental in terms of helping us now in Ethiopia. We are discussing with the Dutch government now a new, very similar outcome-based funding instrument on SRH, and it's because of the work that we did now that it generated interest. But in terms of our experience, obviously, COVID. When you're implementing in a COVID environment, it's really tough. But I think we were fortunate in that I think there was 3 or 4 other bonds that were being implemented. They had to renegotiate terms, contract conditions to implement. But we were actually fortunate. We were one of the few actually that didn't. And despite the difficulties, we were able to achieve our outcomes. And I really put it down to 4 lessons that I've noted. I think the first one is really who we are and what we're able to do. Because our platform generates real-time data, that was a real advantage for us because we had access to real-time data every day. And our girl here, our young lady here talked about Tico. Tico is actually our front-facing brand in Kenya that we use to implement our platform. And she will talk a bit more about her experience. But basically what it allowed us to do is to be able to understand when she took up a particular service, what she thought of that service in terms of her experience with demand generation, her experience with provider, and we're able to use that data every day to adjust our program.
every day we were adjusting our program to ensure that we actually delivered results. So we really loved it because of that adaptive implementation and the power of our data. The other advantage for us is really helped to spur innovation. And I think Amit, you've already talked about that, is that we had to think very creatively about how we can actually then deliver impact and achieve these outcomes on the ground quite quickly. So we were quite excited about that. And it really allowed us to develop a number of technological innovations and other very simple innovations that actually helped us to be able, that we would not have traditionally done with a grant or thought of, to be able to achieve impact. The other real good experience for us, yes, Amit has talked about some of the challenges, as they do take a bit of time to get going. But I think we were lucky in that we had a very good partnership, both with our investor, CIFF. It's someone that we'd worked with previously, and Julia and her team really had displayed a lot of confidence in our ability to be able to deliver. And then also Akacho and her team at FCDO. And that partnership really helped to resolve a number of bottlenecks with regards to actually implementation, and really facilitated, because I think everyone wanted us to win. Everyone wanted us to actually deliver outcomes for young girls and women. And just that partnership and focus was really critical in terms of our ability to be able to implement, to be able to iterate, and to be able to change. So I think those were the key lessons and experiences for us.
Thank you so much, Richard. Yeah, thank you. Yeah, I think the adaptability, the innovation that Amit also referred came out very, very strongly. And again, focusing on, the goals that we have set. So whichever way we are achieving the goals that we have agreed upon. So that's now the experience. Now, Julia, I will come to you. So as a foundation, what appealed to you to take up the role of investor, and especially in the development bond and the development impact bond? There are risks that have been already mentioned. So what is the guarantee for you, and what is the level of risk that you are also ready to take generally in this kind of arrangement?
Sure. Maybe I can start by talking about why we invest, why we're interested in investing in adolescent girls' reproductive health. I think we've heard a lot of statistics here today, and it's always a bit hard to relate those numbers to the human cost of what we're talking about. And maybe when Christabel speaks, she can add to this as well from her experience. But just last week, I went to Narok County, which has the highest level of teenage pregnancy in Kenya. And I was really moved to see that when we had just a normal health event for young people. Most people who came were kind of between 16, 18 years old. It wasn't specifically targeted at mothers, but everyone who appeared, all of the girls who came already had children. Many of their children were already walking and talking. They were talking, but I'm not. And we were, and I was very moved to see what an impact this had on their lives. Almost all of them had left school. Most of them had no viable pathway back to school. Many of them were finding themselves motivated by their parents to enter any marriage that they could find. And for us, we think that this is such a huge waste of human capital. And we really consider empowering adolescent girls, both with the skills that they need to enter the workforce and with the health needs that they require to enter adulthood healthy and happy and following their own choices and goals, to be really critical. And if Africa is to achieve its potential, that it's so critical, and that's why we've invested so heavily in this area. I mean, why we were interested in this bond, I suppose that there are, despite this being such a huge problem, not just here, but really all over Africa and indeed all over the world, there are really very few investable options that really had salience with the target audience. There are many ways of delivering services, there are many ways of putting services out, but there aren't that many that adolescents really engage with as well as this platform. And that's one of the reasons why we were so eager to see it continue and extend. There's very few programs that kind of bridge the gap between digital and equity. I mean, I think when we imagine digital interventions, we often imagine things with smartphones and apps and satellites, etc. And that largely excludes many of the people who are most at need. But this program had pathways for people who only had dumb phones, people who only owned a SIM card, people who had no access to a phone at all and would use a card, but would then be entered into the digital system, that allowed us the confidence of knowing we were actually reaching people who need the services, not just kind of the middle class or people who are already on the internet. We really appreciated the way that this particular mechanism put more power into the hands of girls themselves. Richard didn't go in great detail into how the program works from the experience of a girl, but one of the reasons that it really appealed to us is that it allows her to carry a subsidy to the provider of her choice. So there are many, many different pre-qualified providers within the program, and she's able to take her subsidy where it goes, and it really puts the market mechanism in her hands because she suddenly becomes a appealing customer for all of these private providers that previously probably wouldn't have seen her as someone that they really needed to appeal to or even treat well. We had funded, as Richard mentioned, we had funded this program previously in a more philanthropic way. And we were aware and kind of, deeply appreciative of the visibility that we had over its data. With Triggerise, because of their digital platform, we're able to go into a daily dashboard and see their performance. And it allowed us the confidence that we could easily come in whenever there was a need to course correct. We also knew that the implementer had a culture of being open to that sort of collaboration and course correction. So we felt like they were an organization that we could reasonably manage to expect our money back, really. And it also seemed like an appropriate role for philanthropy. I mean, our money as a philanthropy comes from the generosity of one very rich person, but it means that we're not managing taxpayer money the way that FCDO are. So we were in a place where we could take on that role of risk of the implementation essentially not working. And protect taxpayer funds from that kind of risk, and we felt that was an appropriate role for us to take, de-risking it for a more institutional investor while taking on that risk themselves. And how do you say the risk paid off? The program performed exceptionally well, achieved real cost savings, and we're leaving the impact bond with the confidence that we're not only getting our return back, but that we also made a really sizable impact into the lives of Kenyan girls.
Okay, maybe just a follow-up question
Sure.
Before you hand over the mic to Akacho. So in terms of the risk management,
Mm-hmm.
right there, as you said, the case is compelling.
Mm-hmm.
The digital environment is also favorable for the success of this project. But in situation where probably things do not go, the way planned, and maybe if the goal is not achieved, so what do you do in that case?
So I mean, in many ways, we're in a very happy place because those risks did not pan out. But one of the reasons we chose this investment was because we had the confidence in the implementer to be able to innovate through challenges. And then there were huge challenges during this, as Richard mentioned. Of course, the COVID-19 pandemic that none of us could have imagined when we first started talking about this had vastly reduced the ability of their teams to move around, to gather girls together for information sessions, things like that. Of course, schools were closed for much of the time that the bond was running, but we still, but we were confident that they were able to innovate through it and that we would be able to problem solve with them. I mean, obviously, if those had manifested, we probably would have had to be a much more active manager. But one of the reasons why I think this one worked so well was because the implementer was so well suited for this kind of innovation and being able to pivot and really change direction when needed. And as I mentioned, we went into this because we were willing to take that risk. If we had lost our money, well, we would have lost our money, and we felt that was an appropriate role for philanthropy to play.
No, thank you so much. Yeah, thank you. Yeah. I think there is always a risk, yeah. So we move to the next, to Akacho or as FCDO. So what motivates you to become the Development Impact Bond outcome funder? And what are the experiences in FCDO? Is it, the typical way of, cooperation in your strategy? Yeah, you can tell us if you want that.
Thank you very much. And I think probably what has not been said is these discussions happened well before COVID. I think when it was a very ideal environment, and I remember when CIFF approached us and they were coming up with this innovative way of investing in sexual and reproductive health services. And the Africa strategy at that time for the UK government was basically what was presented in the morning about working on reaping the demographic dividend. And as you rightly said, Kenya has a burgeoning youth population. And this was quite a timely project for us because focusing on adolescents, young girls, and low-income populations in the informal settlements. So at that time, I remember there was a lot of discussion back and forth because, as has been mentioned, we have multiple players. At that time, it was mostly FCDO, CIFF, and we were also being introduced to Triggerise because we do not directly work with Triggerise, but they work with some of our other implementing partners. And as Julia said, what gained us confidence was looking at some of the indicators. So we would actually go to the field and look at some of these adolescent girl programs, see the programs that the girls are being introduced to, and also how they're actually getting access to the services and the contraceptives. So coming back to why we invested in the DIB, which is not our traditional way of investing. Firstly, at that time, it was not a very common phenomenon in Africa. Most of the DIBs we heard about were in India, particularly around maternal child health, adolescent sexual reproductive health. And it was nice to know that at least we can do this pilot and see how successful it will be. I think what Julia has also not said is the rate of return is really low for them. It's only 2%, which I think for any other funder, they may not find this profitable, but because for us, this is our core area of focus, we decided to invest. And the $6.4 million is relatively small compared to the larger family planning project we were funding, which was around $36 million at the time. And the pilot was only for 18 months. So during that time, the pilot was to start in September 2020. However, we started getting challenges in terms of bringing the third-party monitor on board, because I think what has not been mentioned is the more partners you also have, you have to now negotiate with more partners, ensure contracts are in place. And then you also talked about metrics. We had to agree on the metrics, like how will we measure and all agree on how the outcome payment will be made. So for example, CIFF will have their metrics, but from our end as the donor, we also have how we have to measure in terms of the effectiveness, is it economical, as well as agreeing on now the target contraceptive prevalence rate of what we want to see during the pilot. So we were also quite happy that also the initial investment was not high because we're already working with the existing mechanism. So Triggerise already had its program in place, the In Their Hands program, and CIFF has already done similar work before. So it was an easy partnership to get into. Of course, with the advent of the pandemic, it was also limited getting into the field and actually monitoring some of the services. So Triggerise also had to adapt the technology and also start also tracing these girls with the mobile phones. Of course, not all the girls have the mobiles, so they also have to find a way of tracking even the girls who use the card and the ones who also don't have phones. So as Richard said, they had to adapt with the times and also be able to still achieve the targets in spite of the difficult, challenging environment. And then also, in regards of our relationship with CIFF, this partnership also enabled us to have now flexible terms of payment because at times you have to now renegotiate how are you now going to start measuring your outcomes? Because, for example, when we were also hit by other humanitarian challenges like Afghanistan, or right now we have the Ukraine conflict and funds are also being diverted, we also have to come back and renegotiate, terms of payment, because at times this may not be a priority for us at the time. But of course, we are still investing in women and girls. So at least CIFF is able to negotiate and understand those terms of working. And then additionally, the increased incentive for all of us to have a quick win, because for the implementing partner, they want to achieve their outputs. For CIFF, of course, they want to get back the return on investment. And for us, we are quite happy to show how our investments are also producing a very good return. So it's a quick win for everybody. And last year also, we were quite happy when the UN also approached us to discuss how you're strengthening now the partnership with the government of Kenya and how this DIB is now moving to the next phase, which actually shows the success of this program and how it can be moving on towards the more sustainable approach for the government. So from our side, we're quite happy. And as was mentioned, the end-line survey has already been concluded, and we hope to do the dissemination in July.
Thank you. Yeah, very much appreciate. So now I will invite Christabel, if you could share with us your experience in the ITH program. So what is your personal experience, maybe your friend's experience, how it was useful for you?
Okay, as I said, I'm Christabel Anindo from Kibra. We are in a family of 4. I lost my mom when I was still young. I got pregnant when I was in Form 2. And one day, as we were just idling with my friends, there was a mobilizer whose name is Cynthia from Aoche Foundation. She came and talked to us about TICO. She told us that TICO offers some things like counseling, family planning, HIV testing, for free. So since I had dropped out of school because of the pregnancy, I was interested because I didn't want to get pregnant again. I wanted to continue with my education. And then she enrolled us through phone. I had a smartphone, of which there was a code she gave me. I sent it. Then there were some questions I answered through the phone. Then she told me that I was already enrolled. The next day, I went to a clinic. It's called Shofco. And that's where I managed to get the services. I was tested the HIV. I was given the contraceptives. I use pills, which are taken monthly. Then after taking the services, I was given the TICO miles, which I get 50 points every time I go. And these 50 points, I redeem. I go to a TICO shop, I redeem, then I get sanitary towels. So I can say TICO has really helped me a lot, because I'm sure every month I get sanitary towels, I get the pills. I managed to go back to school and did my Form 4. Yeah.
Thank you so much. This is a life-changing program that is providing services to our adolescent and young people in general. Thank you so much. So I think we have 5 minutes more, right? Yeah, because we have participants online as well. I don't know.
We have a second part of this program.
Okay, so we can address the question that we might have after the presentation. Okay, so in that case, let's give a big hands to our panelists. And if there are any questions that we need to address, they can still answer from where they are going to sit. So then at this point, I will hand over to Keegan, who will be moderating the next segment of this session. Thank you so much. Yeah, you may take your seats. Thank you.
Thank you. Thank you very much. I think Medine deserves a better clap. Can we appreciate her once again? And also our panelists, let's give them once more. Without any much further ado, ladies and gentlemen, I think we've had the nuts and bolts of the first development impact bond. And now I just want to call upon Mr. Anders Thompson, the representative of UNFPA, to give us just some insights about the scale up, because the conversation is about taking up what has been commissioned and what has been shared with us to the next level. All right, thank you. So I want to call upon Anders to just share with us a brief on the scale up of the first DIP that we've heard about. And I hope you can join the boat as we discuss. Over to you. Do we have the presentation on? Thank you.
Thank you very much. My name is Anders Thompson. I'm the UNFPA representative in Kenya. And of course, all of you who know UNFPA very well, you know that we work for that 10-year-old girl to make sure that she can actually thrive. So when she gets into a situation like we just heard from from Kibra, that actually there's help to be had. So as I get into my presentation, I want to, no, please go back. Yes, as I get into my presentation, I want you to look at the first slide, because the first slide is actually the most important slide of all, because this is where we have Anissa, who is like Christelle, someone who we want to help. Now, we heard a lot of details about the program. We have some diagrams in this presentation which will be shared afterwards, which will bring all of these components together from the panel in the beginning. But if we go back to yesterday's presentation, we heard James Wangi, for example, talking about the most important thing for his business success: sustainability and scalability. Those were the two words I took away from yesterday. How can we now apply those two concepts to scaling up help for Anissa and for Christelle? That is really the core question we're here to answer with the DIP today. And that is also the question that will, I think, make it or break it for our case, which we are pitching today. Because when I speak to traditional donors, we had FCDO here, there were people from Sweden, Norway, Denmark in the room yesterday. Those traditional donors, when we have a conversation with them, they always tell us, okay, we have $1 million here, but how can we make sure that most of that money goes to Christelle or to Anissa, not to heavy bureaucracies? I mean, this is the reality, you know, to process and so on and so forth. So the trick to this is the Uber model that we heard about this morning, that we can have a phone, it doesn't have to be a smartphone, another phone, or even a card, that can register that a service has taken place. And only when that is registered can the provider be paid a small amount of money. We are talking maybe $10, something of that nature. And only if the service has been rated, like on Uber, 5-star, hopefully, then the money will actually flow. That way, we can look as fund manager, the outcome funder, of whom there hopefully will be many, in the eyes and say, we can show you all the data. We can assure you that whatever investment you made, that the money actually reached the beneficiary. So that's really the most important, that this girl who is sitting here can talk directly to the outcome investor and said, yes, I did get the service that I needed. So what are you doing? You're only paying for the results. If it's not rated highly, if it's not provided, they will not pay. And this is where, as an outcome funder, this is where the investor who are on the panel here, they take all the risk. So they have an incentive to make sure that the system works. The other word of wisdom yesterday from James Wanke was to move from disbursement to investment. And moving from disbursement to investment, he basically defined as de-risking. He was talking about de-risking all the time. So these complicated systems that we have set up is to de-risk this flow of funding to make sure that this can all happen. So there is no risk for the outcome funder, zero risk. So let us move on to the next slide. Because, I mean, we have heard the problem about teenage pregnancy, high prevalence of HIV. We want people to go to the clinic to have family planning methods or get tested, etc., for HIV. And why do we want to do that? Because and why would we pay a little incentive? Because we feel that, let's say, the $10 that we are paying for that person to get the help can result in a 10-fold or 20-fold gain for society. Because if Christelle can stay in school, she will be able to contribute productively to society. So that is the return on investment. It is more abstract. It is not as easy to sell as when you go to an agricultural community and you invest in a farmer and they will actually produce something that can be sold on a market. That's not what it is. But what we do get is we get a public good contribution to the economy, and we help Estelle and Anissa at the same time. So I think that is a very good investment. So these are the problems that we are solving here on the slide. Next slide. So here you see the chain of events where Anissa is mobilized by organizations like TICO. That is the de-risking part of it. She comes to the clinic. She will rate her service on the mobile phone, even if it's not a smartphone. All of that data, as you have heard, goes into a database. It can be looked at real time, and only when an evaluator, usually one of the big evaluation companies or audit companies, go in and sort of evaluate and verify the entire ecosystem, will the money actually flow from the outcome funder to the investor and actually be paid. It doesn't mean that the provider will not be paid immediately like the Uber driver, but it then transfers the risk between these different actors. So here we have explained that whole chain of events, which is really what allows us to ensure that value for money for the outcome investor. Next. Outcome funder. Sorry, I'm mixing the names. So here, this is, there's a lot going on in this slide. It is just to tell you that we have had the pilot where FCDO was involved. We have now launched a new bond. We are hoping to raise 20 million for that bond. We will be supporting women and girls in 10 counties. There are 300 clinics that have been pre-selected based on the level of teenage pregnancy and risk of HIV in those areas. So the most vulnerable areas have been selected. We are very happy to announce to you, and this is part of the launch today, that we have already gotten a contribution from around about $7 million to go into this from the UN SDG Fund, and thank you very much for this. Jointly with UNAIDS and WHO, we are working to establish this entire system. And how do we then get to the 20 million? Of course, we want to prove to you that it's working. So we will launch this system, so it will go live. It's already been tested, but in the fall, we'll invite you, whoever is interested in funding, can come to those counties with us. You can see how it works in action. This is actually an invitation to you to come with us jointly with UNAIDS and others to see how it works, to see if you would like to invest in this. As it was posed the question yesterday, what to the investors, what do you expect from the UN? One of the things that was said yesterday was that we expect UN to be catalytic, meaning that the SDG fund would put the seed money. That's what the donors said. So now they have put the seed money and we have qualified. So we are that far in this progress. So we will keep you informed. We will engage with you and see how we can get to the next level. Next slide. So again, this is a slide that explains how these results are achieved. We will distribute in the interest of time after this. Next slide. And here, the system of how the funds are flowing, how we have secured the 7 million, and thanks again for the UN SDG fund. We are looking to mobilize another 13 million from outcome investors, traditional donors, private sector, or it could even be through crowdfunding. We are studying who could be interested in coming in here, and this is how it explains. And then the last slide is just, if you go to the next slide, a timeline. No, not the timeline yet, but this is a slide that explains how all the members of the previous panel are connected, that you have the outcome funder, you have the investor, how it connects to Triggerise, and how there is also the evaluator, basically all the things that Richard explained so eloquently, but here you have a diagram that you can refer to afterwards. And lastly, the last slide is the timeline for the rollout, and we really hope to get the support. This is really a joint effort of many stakeholders who really want to achieve two things only: making sure that the outcome funder doesn't have any risk and that they can comfortably invest in that young girl and make sure that their money is actually going there. And then first and foremost, make sure that Anissa and Christelle here can stay in school and can delay their first pregnancy and can also be adequately assured that they will not get HIV/AIDS. So thank you very much for being part of this, and thank you so much also to the Ministry of Health for championing this here in Kenya. We are really so grateful for the opportunity to present this today, and we hope that we'll be able to change the lives of 500,000 girls in Kenya is the goal. Thank you so much.
All right, thank you very much, Anders. I think he deserves better than that. In the interest of time, I know time is not on our side. I want to just welcome 3 questions on the DIB and also the first presentation. And we can take that very quickly before we have the final part of the program as we wind up. So 3 questions. I think there'll be a roaming mic. You can just ask very quickly. Let's try to be succinct on the same. Right?
Hello. Yeah, thank you very much. My name is Wandera Manasseh. I come from Rwanda. I work for Society for Family Health as a local NGO. I take a particular interest in the presentation both presentations and also for what the panel presented. Definitely there is you sense value for money and also significant impact. My single question is about the younger ladies' impact. I was wondering if also she's able to use the coupons or what she delivers, she gets for school fees. If she's able to get some of the points can be used as her school fees. Thank you.
Very much, very clear. I'll take another one at the center, and then one on this end. There's a hand here.
There was one on the same table.
All right, I wanted to do distribution. Okay, fine. Let me just put a caveat. We have a deep dive session after this. There's going to be a deep dive session so that then we can be able to channel most of those questions there. So let me just allow that exception, then we'll come here.
Okay, thank you. I'm Matthias from UNFPA Rwanda. So mine is straightforward. I want just to understand a bit more about this third party entity that is doing the verification of the metrics and ensure and how it is organized the payment after verification of these metrics. Thank you.
Thank you very much. I think we continue that spirit. Last question. The center then. So Richard, in the meantime, you'll prepare to answer the question on verification. And I think we'll give the young girl an opportunity to just say one word. And then, yeah.
Sure.
Let's just take up the question.
Sorry.
Yeah, thank you. I'll be brief. I'm Taz Chaponda from Malawi, heading up a DFI. And this kind of intervention is highly, highly relevant, of course, for other low-income countries like Malawi, where we face the same level of challenges and in some instances more acute. We, for one, would be interested in exploring something like this as an outcome funder or jointly with other potential donors. And so the question is, once you have completed the pilot phase, what is going to be the length or timeline for the full rollout? And two, would the partners consider working with us in Malawi for a similar intervention where we could come in as an outcome funder?
Thank you. So I'll start with Richard. Maybe you can just respond to the first, and maybe you can also take up the second question on why not pay school fees.
Sure. Actually, that question around school fees is important because essentially, as Triggerise, our philosophy and approach is user-centered. So we respond really to the needs of users. And increasingly, education has come up as a key issue. Vocational education, technical education has come up as a key issue. So I'm actually pleased to announce my colleague is here from the German Development Bank, that we've gotten a grant of 9 million euro, and that will allow us now to actually voucherize, as our colleagues were saying, access now to jobs, skills, and opportunities. And it's really because of the success of the impact bond that we were doing together with all of the partners that I was on the panel with, that we're actually able to do that. And that's something that we are going to increasingly do going forward in terms of develop a holistic platform that responds to the needs of girls wherever they are and wherever need they may actually have.
All right, thank you. And let's go for Richard. I'll take this opportunity to just mention something about the last question. The colleague from Malawi, we are amenable to that kind of partnership. Let's talk, let's say it back after this in the interest of time. So a round of applause, ladies and gentlemen, to the people who really made it happen. And I want to call Arif to come into the last few minutes for the last session of the program.
I think there was a question on metrics, so maybe Richard needs to quickly address.
Yeah, sure. Our colleague from SFH Rwanda. Yes, the function of the third-party verifier is really to do two things. One, to verify the internal consistency of the data that's actually generated by our platform, that actually there's been no manipulation and that it has sufficient integrity. Secondly, they do undertake work in the field to also undertake their own verification. And then finally, they've been implementing the baseline survey as well as the end-line survey for the modern contraceptive prevalence rates. So that's the function that they've had. And just quickly, Taz, I'm actually Malawian myself. So, and definitely as Triggerise would be interested in having a conversation.
All right, thank you very much, Richard. At this juncture, I want to call upon Arif once again to lead us into the last minutes of the program. Back to you.
Thank you very much, Keegan. Thank you all. Thank you, Anders, and the whole panel, the whole team. I think it's been a really rich discussion. We could do with a couple more hours, ideally, in a really deep dive. We can do a deep dive, so that would have been nice. I'd like to just also acknowledge some really hard work behind the scenes. You can imagine the heavy lifting that's been going on around bringing all this together. So the technical team, we've got a group that meets 2 or 3 times a week. That's been going on for over 2 years, I think now. The UN agencies, UNFPA, UNAIDS, WHO, CIFF, Triggerise, FCDO, we've got a fairly cozy group here, and it's been working really well. So I must acknowledge all the technical team members, I won't name them, who've been putting in a huge amount of work here. A great pleasure now to get to the last part of this program. Sorry, we're running a bit late and eating into your coffee time. To invite the Ministry of Health, because ultimately we really want to think about how this scales up. You know, we want to move from pilotitis and puffs of excellence in a sea of deprivation to something that's much more long-term, more sustainable, goes beyond fiscal and political cycles. And for that, the Ministry of Health is really our core partner. So unfortunately, Kes Arashidaman, the Chief Administrative Secretary, whose boss actually was in Geneva, so CS Kagwe couldn't join us. But we're delighted that Dr. Estella Waiguru has stepped in, and we would welcome your comments on behalf of the ministry. Thank you. Following that, we'll just have one last very pleasant duty that we're going to give to my friends Max and Elaine from the Joint Fund. Thank you.
Good. Are we still in the morning? Good morning, everybody. It's wonderful to be here with you, and it's an honor to be standing before you to represent Chief Administrative Secretary, Dr. Arashidaman. If you'd give me a minute, I want to tell you something. Can I tell you something? Yesterday, I was in a meeting with several people. And you know what we were discussing? We were discussing adolescents and young persons. And what I actually want to tell you was what happened after the meeting. I was sitting in the restaurant within the hotel facility, and I couldn't help but cry. Because what was coming forward was that adolescents and young persons are really desperate, and they're making decisions out of that desperation. Decisions that are costing their lives, decisions that are costing their futures. And it was very apparent that control over that situation is in our hands. And so my tears were because we were supposed to be acting yesterday. Our decisions were supposed to be made way back. But we are never too late. And so we are here. I consider this a God-given opportunity to be in this particular podium at this time. And so I want to say thank you to every person here represented that is working with adolescents and young persons in matters sexual reproductive health and beyond. And to congratulate you on a wonderful decision that you have made, and moving forward to say that we are open to friendships, partnerships, collaborations on this field and even outside. Now I'll go to the remarks of Chief Administrative Secretary, Dr. Arashidaman. Greetings, Excellencies, representatives, national and county governments, representatives of the public and private sector, CSOs, the UN family, ladies and gentlemen, good morning. It gives me great pleasure to join this summit today as we deliberate on the critical subject of mobilizing resources to accelerate the attainment of the Sustainable Development Goals. With barely 8 years to go to the year 2030, this is the decade of action, and we must strive to do things differently if we are to attain the set goals. The interventions that we choose and the modes of financing must be innovative and sustainable. We should leverage strategic partnerships in government, the private sector, development partners, and philanthropies. The Adolescent Sexual and Reproductive Health Development Impact Bond that has been showcased here today is a perfect example of innovative financing for SDGs, where results meet impact are at the center. As a country with a significantly young population, we are keen to ensure that the country's future is not compromised by adverse health outcomes, such as would be brought by early unplanned pregnancies, the complications resulting thereof, and infections such as HIV. Many of these outcomes contribute to mortality and morbidity, resulting in a lifetime of missed education and employment opportunities, especially for adolescents, more pronounced in the girls. The Adolescent Sexual and Reproductive Health Development Impact Bond provides us an opportunity to activate public and private partnerships and unlock resources from traditional and non-traditional sources to tackle the challenge of teen pregnancies, new HIV infections, and AIDS-related deaths among vulnerable adolescents, girls in 10 high-burden counties in Kenya. The results-based financing approach associated with the DIB is of utmost importance to us as the government, given the great emphasis on impact towards result as the basis for payment. You will agree with me that we have in the past had several interventions and investments in different spheres of development, but more often than not, change is not to the anticipated extent. Ladies and gentlemen, we are particularly excited as the Ministry of Health to be working with a joint UN team comprising UNFPA, WHO, UNAIDS, the SDG Partnership Platform, the Office of the UN Resident Coordinator, partners such as Triggerise, COIS, CIFF, and various county governments in this exciting initiative. I want to express my sincere gratitude to the Joint SDG Fund for allocating $7 million to the ASRH Development Impact Bond project as catalytic fund to unlock additional investments in the target counties, which are Nairobi, Mombasa, Kisumu, Migori, Homa Bay, Kisii, Nyamira, Bungoma, Busia, and Kakamega, and facilitate equitable access to sexual and reproductive health and HIV services by over 500,000 adolescent girls over a period of 3 years. This catalytic investment from the joint fund will immensely contribute to one of our big 4 ambitions of providing universal health coverage to all Kenyans and prioritizing the left behind populations such as adolescents and young people. We hope that through joint partnership, we shall be able to unlock additional investments to actualize this ambition. It is my firm belief that with this new mechanism of financing, we shall see more innovative mechanisms of financing for health and other SDGs being deployed, and that there will be a significant change in health and different development outcomes. I thank you all. God bless you.
Thank you all. I'd like to now go to the finale on showcasing this amazing, innovative development impact bond, which we understand might be the world's first one for adolescent sexual reproductive health. The Ministry of Health has been an extremely strong partner, very supportive, and we would like to convey through you, Dr. our appreciation back to Arashidaman and to CS. I'd like to now invite our friends from the SDG Joint Fund, Max and Elaine. And I would also like to invite colleagues from the UN. I've got Anders, Medine. We would like to have Richard, Julia, Ministry of Health. If you could please join us. Amit, please join us. What I'd like to do is, this is a bit of a Kodak moment, so bear with us, but it's been a long time coming. We'd like to sort of officially launch the award for $7 million that is being provided by the SDG Fund. We had an open competition, over 190 countries, 155 countries applied. We came 16th. We spent a year strengthening the proposal, and we won it the beginning of this year. So it's been a huge amount of hard work, and there's a whole team that's behind it. But certainly it's something that I think other countries might also think about using and thinking about as we expand this. And I know the boss of Triggerise is here, so he's been thinking about Africa and more broadly. So I'm sure that there are scale-up opportunities here. So colleagues, without further ado, I'd like Max and Elaine to stand with the group and maybe the Ministry of Health to be receiving this symbolic check of $7 million so that we can crystallize this moment in terms of the SDG Joint Fund announcing its launch. Thank you very much. I don't know if Max would like to say a few words, but he who pays the piper calls the tune. So, you know, what do you do? How are you?
Thank you, Arif, and thank you to everyone. It has been a long journey. I worked with the team myself for about 2 years, so I'm very glad that we could make it today. Also to say a big thank you to our donors who are also in the room, Spain, Sweden, and many other, Germany, Switzerland, I will not name all, that European Commission and the European Union that made actually this check possible. So thanks again to everyone. We look for the results and to work with the team to make it happen. So thank you, everyone.
Thank you all. And with that, this concludes the program. I'm going to just ask Richard to stay back for a moment. He's got a special offer from Triggerise. So over to you, Richard, if you want to put it on the table. Thanks.
Sure. Just to let you know, if there's any of you actually want to come and see our program in the field, we have some time available tomorrow, and we'll be able to then arrange some field visits where you can actually understand our technology and how we work in the field. So feel free to just come to myself or to Keegan, and we can just confirm the arrangements for you. We are particularly interested in those with the money, the investors and the outcome payers, but everyone else is also welcome. Yeah.
So you see, guys, the bottom line is, you know, that old Beatles song for old timers like me. Money can't buy you love, but it puts you in a good bargaining position. So, you know, let's get the money. Also to make sure that alignment is about enlightened self-interest. So really, it's about making sure that collective action happens through pooled funding. And that's, I think, a very important trend now with the funding compact. Thank you all once again. Sorry we took over a little more of your coffee time, and apologies for that, but hope you enjoy the rest of the sessions today. And for my UN colleagues, I hope that you will be able to join us tomorrow for the UN peer learning sessions, which I think will be really exciting, and we can pick up on many of these models and your models, because a wise old man once said, the biggest room in the world is a room for improvement. So we need to learn. Thank you.
Good morning once again. Good morning. Morning. All right, we're just about to go for the coffee break. But before we go for the coffee break, may I ask us all to rise just for 1 minute for us all to rise. All right, and may I ask Christabel to come to the front here. So I asked you all to rise because today we launched, as you saw, the world's first adolescent sexual reproductive health development impact bond. And Christabel is the face of the adolescents here today. And because she was so confident and fearless, I asked us all to stand to recognize that and give her a round of applause. Thank you, Christabel. And now with that, we can go for our coffee breaks. And the coffee breaks are outside near the casino. And the next